I'm Dr. Lakshmi Kantamneni. I'm the consultant, plastic, cosmetic and reconstructive surgeon at Pace Hospitals, Hyderabad. Gynecomastia term itself is self-explanatory and it means development of breast in man. The breast tissue develops in male due to the influence of female hormone called estrogen. The gynecomastia is also commonly called as man boobs. This occurs due to increase in the ratio of estrogen compared to testosterone. Gynecomastia is mainly caused by two broad factors, mainly physiological or pathological. Physiological, it can occur during neonatal period, which is due to maternal estrogen influence, which is secreted in the breast milk. It can also occur during pubertal period, where there can be imbalance between the estrogen and testosterone ratio. And lastly, it can occur in old age, where the testosterone is less produced from the testes and estrogen dominance is present. The pathological condition where gynecomastia can occur is due to external steroid intake, drug intake like alcohol, marijuana, heroin, some endocrine abnormalities, some congenital abnormalities where there can be high estrogen in case of hypogonadism or Klinefelter syndrome. It can also occur in liver disease, renal disease and adrenal disease. Basically, there are two types of gynecomastia. One is pseudogynecomastia, another is true gynecomastia. Pseudogynecomastia is mainly due to fat accumulation or fat deposition in the male chest, which resembles like true gynecomastia. This can be corrected by physical exercise or reduced weight and diet. The true gynecomastia, it can only be treated with surgery. It is a commonly done daycare procedure which is minimally invasive. It can be done as a keyhole surgery where the scars are hidden in invisible areas and the patient can go home the same day. It can be either gland excision or combined with liposuction, where the fat is more, liposuction is needed. Otherwise, if only gland is present, only the gland needs to be excised. The main treatment, as I said, it's only surgery. The surgery depends on the grade of gynecomastia. Broadly, they are classified into 3 grades. In grade 1, where there is small breast bud development or small gland development, what we can do is we can remove the gland. We can excise the gland. In grade 2, where there can be some fat along with the gland. In that case, we have to do liposuction and gland excision. And in grade 3, where there can be excess of skin and excess of gland, excess of fat, in that case, we have to do liposuction, we have to remove the gland, and in case if there is skin laxity after the surgery, we might need to address that skin laxity. It is always advisable to consult a board certified plastic surgeon who is trained in cosmetic surgery and who has experience in gynecomastia surgeries. You should verify if the doctor has done previously and how are his results and how are his complication rates, and then you should proceed for surgery. S. Once it's well developed, the breast tissue or the gland, it can't be treated medically. So, it has to be removed surgically. Only in few cases during puberty where there is slight enlargement of gland, and if a patient presents at that period of time, he can be treated by medical anti-estrogens like tamoxifen and clomiphene citrate. Otherwise, in well-developed gland, only the surgery is the option. Yes, of course, it is curable. The only option in a well-developed gland is surgery. As you know, it can be done as a keyhole surgery and the patient can be discharged the same day. So, you do not need to worry about the procedure. Yes, it is safe in experienced hands in accredited hospital and where all the safety surgical measures are taken. Male breast cancer is very rare. It is less than 1% compared to females. But the conditions which cause gynecomastia can also cause male breast cancer. Otherwise, gynecomastia directly does not cause cancer. The conditions which can lead to male breast cancer are high estrogen conditions in case of Klinefelter syndrome, hypogonadism, or adrenal abnormalities. Per se, it is a harmless medical condition and it is benign enlargement of breast tissue in male. But it can be associated with underlying liver failure or renal failure or endocrine abnormalities or due to some drugs. So, the cause must be treated initially and then the gynecomastia surgery needs to be performed. Most of the patients presented to my OPD will be less confident, they feel shy, they change their posture while sitting, and I hear stories of restricting their physical activity, their interests, and not socially engaging with other colleagues, and psychosocial issues. Gynecomastia is treatable. So, we do not need to worry about all these issues and please get treated gynecomastia. It is not a harmful condition, but it can improve your self-confidence. Gynecomastia surgery can make a difference. Hope this information was useful. Thank you.